husband. So it
Yeah,
so
sorry.
it means that the boy or the man are the one who bear the family tree.
Okay.
So they are the most important person in the family.
Yeah.
So all the priorities are naturally given to the man. So when we mention about, oh, you have cataract, please go to the hospital and have it treated. And a lot of answers that we get from the women is that, okay, I think I can see it. My husband or my son, maybe they need money for other type. They need money for other things. So I think the social norms in Vietnam is still something that like considered is the main barrier.
One of the barriers, yeah.
Exactly. But when we go down to the community, we also see that the family, they do not have money, the financial barrier. So one of the things,
yeah. So it's also like an entanglement of financial, societal pressure as well. Like you were saying, women would rather sacrifice, their finance because men have to work rather than them sending themselves to the hospital and being helped there, like women. So they would rather sacrifice it and let the man have it. Yeah. And for Nepal, Anil, would you say that it's quite comparable actually?
Yes, Nepal is not much different than Vietnam, what Lance mentioned just now. But we still have even more those kind of things. As you said, that the biggest barrier. So if I have to, not being specific, so there are social and family obligations. Okay, so women are morely busy in the household activities, like they are the main responsibility. Women's role in the decision making is very much less. Okay, even for the woman, they need a family consent, even to seek the healthcare services. Okay, so financial discrepancies are already there, dependency. So more women are more dependent on the finance towards the male. That is already Lan mentioned about. And geographical access problem we do have in Nepal. It's a very geographically very difficult areas. High hill mountains are there. Transportations and security challenges for the women are there. Okay, so I can also see gender disparity. Okay, in the service provider. So male, sometimes the female. Less number of female service providers are there in terms of the ophthalmologists, and beliefs are there that if the male provide the services, they find it must be a good quality. Okay, so those kind of things are already there. Awareness, lack of awareness. But to be very specifically, if I have to say it, as a financial, yes, financial barrier is also there. Women are morely dependent on the male for the finance. Okay, so for the day-to-day spending. So when we talk about these resources, if the women do not have the excess, then they have to go to the male, and then that is already
a barrier.
Okay? But culturally also, and that barrier is there, but when those kind of things, but still we try to provide the services. And for the female, that is only the financial barrier is there, means that they have to wait for the whole year or 6 months or 8 months to do the free surgical eye camp. When the eye camp goes to that areas that will be supported by Eye Care and other donors or other agencies, that will be
the only time.
That's the only time, and then it means that they do not have to pay. So it's a free, that is financial. And culturally also, it's a very large populations live in the remote areas. Okay, so even for the woman to leave the house for the eye care seeking behavior in the urban area, they have to take the permission from the male persons in our household. Okay, so all this makes the problem bigger. That means the woman will be less recipient of the service. So there are one last thing I would like to say is, even sometimes male and female are working, there is a disparity between their pay scale. The woman for the same job, male will get a bit more, the woman will get less. That all, I will say that financially is also there, the cultural things is also there, and system design is also, we need to think in a different way, the bigger platform. Okay.
Yeah. So thank you for zeroing in on that, Anil, because the No Woman Left Behind is actually a policy from the United Nations women's policy, because you've both mentioned, both in Vietnam and Nepal, this is not only a financial barrier, actually, it's also a societal barrier. And like what you've mentioned, Anil, even the social cultural norms, the patients would rather go to male doctors, for example, rather than female doctors, because they feel that male doctors are more trustworthy than female doctors. So that's also another thing that we have to address with these policy changes. Now, looking into those, maybe in the sector of leadership, because Anil has mentioned like the trustworthiness of male is higher than female. I want to ask both of you in terms of female leadership and so women leadership as well as women beneficiaries. For Lan for Vietnam, we've seen strides in women leadership actually in Vietnam. What do you think helped this progress?
Actually, it cannot be done like overnight for the women to be the leaders in eye health. For myself, an example, but honestly, it thanks to my parents. Like they are really encouraged me to do whatever I prefer, and they are well educated. So I think from Vietnam, like within like 15 years now, Vietnam government has really promoted the policy. We can say policy is education for all. It means that every children are like compulsory or supposed to go to school. Everyone,
education.
Education for all. So I think it is very strong policy of the government to promote women or female students to participate fully in education. So hopefully when they graduated, they can join in any social and economic activities. And also another thing in Vietnam is that the government is open for a new program. If everyone remember, like 10 years ago, Vietnam, Eye Care Foundation, we have supported Vietnam to open the optometry school. Before, like 10 years ago, Vietnam, we did not have optometrists. So it is really a new profession. So the government, when like work with Eye Care Foundation and with other NGOs, and they see the opportunities expanding the professions, and they opened a new one. So with this new profession, so a lot of female students, they join the program.
Eye care. Oh, dingen. Wacht even. Wat heb ik nou gedaan? Wacht even.
Really, even kunnen dempen alsjeblieft.
So with the programs, with the new program in optometry.
En hij zit in Nepal en hij zit in Amsterdam. En ze praten dus over het feit dat vrouwen minder onderzocht en behandeld worden als het gaat om oogziektes.
Oh ja? Mevrouw, zouden jullie even kunnen dempen?
Oh, neemt u niet kwalijk. Sst.
Nee, is geen probleem hoor, dankjewel.
Oh, ik zal meteen even kijken, dan moet ik... Ja, sorry. Ik heb hem helemaal uitgezet. Sorry.
Is geen probleem, dankjewel. Gebeuren. Maar wel.
Okay, I can continue, right?
Yeah.
So with the policy on education for all and the open and extend of new programs in eye health, that a lot of students, including female students, they are able to join those programs, and also the workforce in eye health increase. So, and we also have few role models as a female ophthalmologist and female optometrist. So this kind of like inspire others to follow the route. So also encourage a lot of women to enter the profession. So I think it is really with a lot of commitment of the government in terms of education strengthening.
Yeah. So maybe just a quick roundup of that, Lan. I see how the government has helped in terms of policy, for example. So that's very high level. But at the same time, the importance of representation, because there are women leaders, so the other women get inspired to join the program. I have a feedback. Let me just there.
Yes, exactly.
Yeah. And now for Anil, I want to talk about the female community health volunteers, because that's also one of the things we mentioned at the beginning. Like Lan was saying, in Nepal, in Vietnam, there are policies targeting the whole population to be educated, but at the same time, there are also women who become role models in the field of eye care. That's why other women get inspired. Now in Vietnam, in Nepal, you have this program that you call the Female Community Health Volunteers. How does it help with the promotion of eye care in the communities when the women are the ones doing the promotion, the awareness?
Okay, thank you, Anil. Yes, you already mentioned about this female community health volunteer. We call it FCHV, and they are the volunteer by its name. Okay, so they are the frontliner in any community-based healthcare services. Okay, so from last 30 years, almost 3 decades, they are engaged in focusing on maternity health, child health, family health. All these are related to the woman health. Okay, so they are already working there, and this being a very volunteer services, the other health services in the mainly the maternity things, they are already involved from last 30 years. Even they are recognized by the WHO in 2025. Also, they got the Nepal's FCHVs were recognized. Since there are already one cadet is there in the community, the female volunteers. So what eye care service provider did was, why to invent wheel? So we just try to grab the female volunteers in the community, and we provided them the basic 1 day's training on the eye care. Okay, basically that's do's and don'ts about the eye care, what we should do, what we should not do. That is for the layman, it's a woman. So basic eye care 1 day program was there. And also in that orientation program, we give them what are the services available in the community, what are the service available in the hospital, nearby hospital. So they knows all these kind of things. And being the community, being already in the working in the community, now when there is any eye problem or something like those comes to them, then they are already able to guide them or to refer them to the particularly to the service seekers providers. So that is what eye care did, was which populations, the female volunteers already were used by the Nepal government, the community, the municipalities are working. We grabbed them and then provided the 1 day's training basically. So with involvement, so we are using them as our message to be a first point
to the communities. Yeah.
So in that way, this program has been really going well. So we also, but there are almost 54,000 female health workers in Nepal.
Wow. So, and are they all volunteers?
Yes, they all are volunteers. And then the Eye Care Foundations, in a year, we do around 300 to 400 training per year. And then there are also other service providers with the hospitals. We also train them, aware them. So there are a lot more to do, but this because they are very much well accepted by the community, and they really knows the community. So it is easy for the eye care service provider to use them from the beginning. Okay? So
because the community knows them.
Yes.
Yeah.
Yes.
And maybe for the information of our audience, so Eye Care Foundation, we do not only do training for ophthalmologists, for optometrists, but just like in Nepal, we also do training for female community health volunteers. And these are volunteers who are the main point of contact of the community. So whenever they have eye problems, they do not easily go to the hospital, but they go to someone they know in the community. That's why I think personally the way that the manner that we're using the female community health volunteers is very effective. But I think we need more awareness raising actually. I want to ask the next question to Lan. Do you think a same initiative can also be applied in Vietnam, like female community health volunteers, or something where the female will be the lead in the effort?
Yeah, I think the community-based women-led eye health model is really needed in Vietnam as well. Because in Vietnam, we already have the Vietnam Women's Union, and it is one of very few unions who have the network from the national level to the grassroots level. So in each village, we have kind of village women's union. So some projects we already used the member of the village women's union member to be our volunteer health worker. However, I think, with a lot of responsibilities that women they bear, so sometimes we have challenges of them to refuse to attend the activities because they are busy with the children, they are busy with the household. So I think that community-led by household, female village worker, we need to consider also other responsibilities of women, so that if we minimize the household responsibilities, or we support them by have someone like mentors, for example. So I think they will contribute a lot to our eye care activities in the community, because women, we are women. So it's a tendency of seeing things clearly than men, I have to say. and kind of like we have caring feeling. So when we see people who have like eye problems, like with cataract or with other eye problems, we tend to encourage or tend to have the Anil already mentioned about trust, mentioned about the convenience. So we tend to give that advice to the people in the community. So I think just the natural thing. So I think really if needed, the community-led, community-based women-led is really needed, and it should not be applied only in Vietnam, also in other countries that ECF is operating, like in Cambodia and for Tanzania as well, because I think women is half of the population. So it's good that we can tap into that exist network and really make our eye care projects be implemented effectively.
Yeah, I want to follow up on that when you said like women representation is very important. How do you think does that help with accessing when patients see women? How do you think does that help with raising awareness? Is it more effective, or what were your experiences with that?
For those people in the city, it's okay, because whoever that you meet, like with the male doctor or female doctor, it should be okay. But especially for women in the rural, in the countryside, and those from the ethnic minorities, I have to say. So it's really important that we can have the female doctor to give treatment for those patients, because I already mentioned about the level of trust. We tend to have more trust, and we tend to talk more when we have visit doctors who are female.
Okay.
So I think it's really like important, so that very important. And of course, in communities, sometimes we have to accept the truth that there's not so many female doctors
Yes.
in the communities.
Yes.
But if we can mobilize or we can educate and we can use more female doctors into our community work, so I think it would be tremendous impact,
Help.
impactful,
Yeah.
really helped.
And I want to ask the same question to Anil. How do you see how the effectiveness of the representation of women as leaders in eye care? It could be the doctors, it could be women leaders like Lan or Sujata, for example.
Sorry?
The effectiveness of women leaders in eye care. How do you see that in Nepal?
Yeah, it's again, I said it, all the backgrounds will say it is very much less, but it is gradually picking up. This issues has been gradually picking up. More females are coming. Then in the policy making also, we are focusing on that, not only in the policy making, but sometimes in the regulations, the rules also. There are easy some of the time, but for the certain period, we make some rules and regulations which will encourage women to come forward. So those are gradually coming up, but we are also not different than what Lan said.
Yeah. Okay, thank you for that. So yeah, we've seen how important women leadership actually is, and not just leadership, actually, just representation itself. How important it is. Like, female community volunteers are easily approached because they show that they care, for example. And Lan has mentioned the impact that women leadership has. In terms of impact, can you share with me like one very impactful story of a woman in eye care, of a patient that you have helped? Let's start with Lan. Is there some, like, if I say, there's one very impactful story for you, what will that be?
We have quite a lot of stories with a lot of impacts for patients. But I remember most is a lady who is doing the trash collectors. In Vietnam, we have different people who collect like the trash, and then they can like coke, so that they can sell for some money. I can say like trash collector.
Trash, like garbage collector.
Yeah, so that they can sell some of the like plastics and sell to the for another like factory for some money. So that lady, she's in the far away in Vietnam province, and she didn't have money for cataract, and we provided freely with the cataract surgeries, and we also supported her a small amount of transport because she's living alone, and her children is working in Ho Chi Minh in the Dachong zone, so cannot be always available. So she is taking care her grandchildren. So after receiving our support and having the vision back, we visited her at home. She's so happy, and she said that thanks that like with on the surgery, and then she could see again, and she could feel useful again. Even though it's kind of like impactful for the lady, so she can be useful for her grandchildren and children. But on the other hand, I feel very sorry because at the age of 75, she still like had to work into support. So again, with the social norms that I shared earlier in Vietnam, that women are supposed to be the family supporters.
To keep the family.
Keep the family, to keep it home. So when they are at the age of retiring, but they still need to support the children. And they have no pension fund. So all their living expenses depend on their children. So that's why they tend to support the grandchildren to be, how to say, pay back to what their children have supported.
Has done, yeah.
So that's why really the cataract operation or the treatment of the eye problem not only deal with the financial barrier that Neil and myself mentioned earlier, but also deal with the self-esteem, deal with the useful attitude, the feeling that the lady that the women they can improve. So I think that lady is really in my mind, and I just think, okay, she's just only one example. We still have thousands of examples, thousands of women
we don't have
who
enough
are
time
living over there. Exactly.
all of them.
So exactly. So really, I really hope that Eye Care Foundation with can support a lot of women, so they have like how to say, they can have access to eye care, and also we can reduce some of the burden for the women when they have problems, so that they can really see back to the life.
Yes. So thank you, Lan. So you were, you just shared about the 75-year-old woman, right?
Yes.
Yeah, 75-year-old woman who was collecting garbage, and then she had her cataract, and we saw how impactful just one very simple surgery, which is cataract surgery, and it actually changed her life. Like she felt useful again for her family, but at the same time she could help ease a little the financial burden of her family, and maybe also help with the caregiving for the grandchildren, which is also quite the societal norms in Vietnam. And I would love to ask Anil, do you have maybe something similar, like an impactful story of a woman that we have helped in Nepal?
Yes, Daryl, we do have. And then as we discussed, there are a lot of stories, those kind of things, which brings a lot of impact. But now I would like to put this in a two aspects. One is service seeking and one is service provider. So we already heard the service seeking. What if we seek the service? What would be our benefits? What would be the impact from 75 years old lady? We have already seen it. But now I do not want to go in that same segment again, the service seeking, but the service provider. I want to go. I have a lot of stories, lot of good impacts over here in Nepal. And we have been doing that and awareing our donors, valued donors, respected colleagues, all these things we have also by our newsletters doing. But now, this time, I would like to tell about the service provider. We have had almost 21 years back, we had chosen one, the bright medical student, and then we supported her in the ophthalmology, MD ophthalmology training. Okay, that 3 years MD ophthalmology residency program in Nepal, in a very good reputed institutes in Kathmandu. And then when she graduated, now she has started providing the services in the OPD. She is a surgeon, fine surgeon, good surgeons. And even if I have to say that with that kind of education, that kind of training, now she is able to provide the service in a 2,000 surgery, almost 2,000, more than that surgery in a year. That is all mostly the sight restorating surgeries she can perform it because of that educations we provided her. And I feel very proud to say that now one of our pioneer hospitals in Nepal, the Himalaya Eye Hospital Pokhara, she is the medical director, she is the leader, she is the leader of that entire 150 people. And she can really do not only in the management, but she can also put some of her skill in doing the daily operations, daily examinations of the eye patients. And she's also there in an outreach, very remote area. So by educating, by giving her right training in the right appropriate time, so we have already done many sight restorating surgeries from her. So this is also one of but this is the service provider I am telling about. Daryl?
Thank you, Anil. That's very good to see. Like you've mentioned not only service provision, not only service access to service, but service provision as well. So Thank you. You were mentioning about the bright scholar that Eye Care Foundation has supported in Nepal, who is now the director of the Himalaya Eye Hospital. I actually met her last May, I think, during the IAPB Congress in Nepal. So
Yes,
really proud of her. And of course, this wouldn't be possible without the help of our
yeah.
donors who are with us right now. So thank you, all of you, for that. Not only that Eye Care Foundation is able to support cataract operations that can help a 75-year-old woman, for example. But it's also because of your support that we are able to send these ophthalmologists to schools, and now they're the directors of eye hospitals in Nepal and also in the other countries where Eye Care Foundation is. Thank you, everyone. Thank you, Anil and Lan, for those answers. Now, I would love to ask you maybe something a little bit policy level. If if we are really serious about no woman left behind, we've mentioned the barriers, we've mentioned the access to eye care, we've mentioned the economic barriers and societal norms. If we are serious about if we're as Eye Care Foundation, if we are really serious about no woman left behind, what do you think should happen at the policy level? Can I ask Anil about it?
Yes, Daryl. Now I'm first. Okay. Yeah. So basically, in the policy level, what we need to think is woman involvement in decision making. How we can involve them in the decision making. Okay, so that is one of the important. I can say it now. So community-based awareness also program, we need to have it. So as in the policy, if we have a community, because in this I'm telling about the Nepal perspective, because we have a lot of rural areas. So then community-based awareness program, if we introduce, then those kind of easy accessibility, timely accessibility will be there. So if we can intervene something on the time, then there is a less chance of having a sight loss. So that is only possible if we involve the community, aware the community. Financial accessibility also there, I can see. So in the policy level, how we can, because we are talking from your first beginning part, so all this financial accessibility also there. So how we can involve them in a financial accessibility. Also, now I already gave you the example of FCHV in Nepal. So if our policymakers involve them in a actively involvement of them in a community, then those kind of things, I think no woman left behind could be happen. Okay, so but these all are the policies. But in terms of day-to-day things, also we can change from our side, just like a separate fast-track services for the female in the hospitals, in the clinics. If we do those kind of things, woman-friendly environments, if we create something like a breastfeeding room or some good sanitations, all these things, those also helps. Yeah, right?
Yes. Thank you, Anil. You are actually right about that. Sometimes we tend to neglect these small things, like you've mentioned the breastfeeding section. I mean, if you're a woman who's busy taking care of your baby at home and you don't know where to breastfeed your baby at the hospital, why would you go to the hospital? But if you know there's a facility for that can help you, indeed, that will be a big help. And at the same time, the importance of women decision makers as well, because bodies of women are very different from bodies of men, for example. So I would love to give the floor to Lan. Yeah, if you want to, if we are being serious about no woman left behind, as a woman leader, what do you think should Eye Care Foundation do at the policy level?
I think the two most important factors that Eye Care Foundation we can work at national level to advocate for the policy change. So I think one of the things is the workforce development, because now a lot of like ophthalmologists and optometrists or some of the professional eye health, most of them they are men. So women are, how to say, less number than men in terms of eye health. And we already mentioned about like a female patient feel more comfortable and tend to share more things to a female doctor. So I think if we provide more female workforce, like with female doctors and those in terms of working in eye care professionals. So I think we can really build more trust of the people, and also if the policy to develop the workforce, the diverse workforce, the policy can really encourage the equal opportunities for women in training and also in the leadership position as well. So, and another thing is that if we can really change that policy and we can improve the eye care workforce, so we can have ensure the decision-making bodies like reflect the need of the women patients. Because now it seems that, okay, if you need surgery, let's do surgery. But do they really need the need or the roots of the problem of the women patients is the question. So the workforce development, I think, is one of the things Eye Care Foundation we can work with the policy for change. And the second thing I think is really important for the people, especially those in the community level or from the vulnerable background, is that we need to remove the financial barrier. Anil already mentioned about how we can provide something and then have the people to have access to healthcare. But I think Eye Care Foundation, we can work with the government to promote the insurance coverage. Because now I know that in Vietnam, like about 87 to 90% of the population, they can have health insurance. So the rest of 15%, they have none. So, you know, those 15% normally the women. So if we tap to that policy, and if we really increase the health insurance coverage to like 97 or to 100% is the dream. But if we can work with the government, to increase the health coverage. So I think it's really useful to people, especially women from the poor family, because they tend to refuse treatment because of no money. So if, okay, it is the insurance scheme already exists so that they can go for surgery. So I think it's really essential for the women in terms of eye care. And in case like, you know, for the policy, it cannot be done overnight. For that health insurance, it will take years, like 4 years or 5 years, even like 10 years in Nepal. So we can like target some of the, to support the people from the vulnerable group so that for long term, they can have it free, but in the short term, they also can access the eye care. So I think that two important things for Vietnam that I think Eye Care Foundation we can work with the government in terms of policy.
Thank you, Lan. So you've mentioned the importance of you've mentioned the importance of workforce, not only the importance of representation that we have women leaders, but as well like how patients approach like women ophthalmologists, for example, easier. And also you've mentioned the broadening of the national insurance so that the eye care will be accessible to everyone. So I agree with both of you, and I hope they happen, but they don't happen overnight. Of course, this takes, of course, policy building that it takes years. And Lan, as Evan mentioned, like education policy in Vietnam, it took years to build that. But yes, we have to start somewhere, I think. And maybe the second to the last question, what can Vietnam and Nepal learn from each other? What do you think are the things that you can learn from each other in very short answers? Like how can Vietnam learn from Nepal, and how can Nepal learn from Vietnam's experience? Can we start with you, Lan?
Oh, for Vietnam, because I also have experience to visit Anil and Nepal twice last year. So there are a lot of things that I think Vietnam we can learn. I mean, I don't mention like the whole Vietnam, but also Eye Care Foundation Vietnam we can learn from Eye Care Foundation Nepal. So that like it really, it really considered the importance of having like female community health workers for the outreach activities. some of our outreach activities we have women, but most of them are run by men. So I
Yes.
think it is one thing that we can really learn from Nepal and change this year.
So having more female community workers,
Yes.
especially during outreach. Yeah.
Yes.
Yeah. Because you've mentioned female patients would sometimes hesitate to share with the male care providers.
Yes.
Yeah. So that's something that Vietnam can learn from Nepal. And vice versa, Anil, what do you think are the things that Eye Care Foundation Nepal can learn from Eye Care Foundation Vietnam?
Yes, as we are talking about, I see more maybe with compared to Nepal. So woman empowerment, female empowerment are already more in Vietnam. Okay, so that we need to introduce, we need to put it in the track. Though Lan was already saying that it is still not enough, in the leaderships and others. But when I see it from the Nepali side, I still see that we need to reach over there. So we cannot be at a certain moment, we cannot reach in the top, but we have to do step by step. So I can learn something from Vietnam to empower the woman. Okay, so other things is what I have seen. The good part in the Vietnam is they are already integrated. Their health, eye health, the primary health, eye health are already integrated with the primary health care system. Okay, so whereas in Nepal we are still working isolations. Okay, so eye care is a vertical system, not in the horizontal. So that things, if we can put our eye care also horizontally in the medical colleges, in the general hospital, in the district hospital, so it will help us to bring the more sustainability in the near futures, until if we do the vertical systems. Okay, so these are some of the things that I can say that we need to learn from Vietnam. Okay.
Yeah.
Thank you.
So, thank you, Anil and Lan. Very, very insightful. Yeah, we're now coming to the end of this interview. Afterwards, we'll give our audience some time to ask questions as well. But the last question from me, if there's one thing that maybe in one sentence, if you could change something tomorrow, still in the theme of no woman left behind, yeah, what will you do in Eye Care Foundation Vietnam and in Eye Care Nepal? So in one sentence, what will you do in Vietnam, Lan?
Because it is about gender, it's about no women left behind. So one thing that I can do tomorrow is that I encourage all the Eye Care program to work on the gender disaggregated data, so that we have more data, we have more concrete information about how or what is the prevalence of women in having limited eye health. So that with all the data, so that we can develop our program more efficiently. Because data cannot lie. We cannot say we cannot lie data in terms of only 10 or 20% of women who have access to eye care, or only 20% of women among 100% of men who have cataract surgery. So that data is really important. We don't have that in that level. So not only Eye Care Foundation, but also I encourage all the eye care programs to act tomorrow, to have more data integrated on gender. So,
so more
not only good in the country, but also good at the international
more research. Well. More research. Just for the information of our audience, last 2021, right, Lan, Eye Care Foundation Vietnam has conducted a gender aggregated data to see how the prevalence of blindness in Vietnam was. So that was in 2021. That was in collaboration with USAID, if I'm not mistaken. Yeah, that's collaboration with USAID. So if the audience would want that, just feel free to email me, d.marco at Eye Care Foundation, or Margaret Gales, m.gales at Eye Care Foundation. And for Anil, if there's one thing you want to change tomorrow, what will that be?
Yeah, you have said 1 point. Okay, so it's very difficult to say it 1 point. I would just like to say it: education, education, and education. Okay, with this, we will able to stop saying me first. if you provide the education, good education, then we will think about not only myself. So we will include everybody over there. Inclusion will be there. So when we involve the woman in the eye care, okay, individual, it's not only the individual health. When they receive the good eye care, it's not about the individual health. It will also help in family economy status, okay, economic status. If the woman has a better visions, then it also brings the family economic status up. And also the children education. We should not forget that treating the good eyesight for the woman also helps to give the good educations of their children. And once these two things are there, then we can talk about the community development, okay, as a whole, and it is spread in a bigger scale. So
Yeah.
saying this, I would like to hand over to you, Daryl.
Thank you. Thank you. And thank you, Anil. Thank you, Lan. Thank you. So for Anil, it's more education, and education, which yeah, I agree with both of you. So the importance of education, at the same time, the importance of data as well. Thank you for sharing your very wonderful insights this morning. We've learned so much about, yeah, women access and eye care both in Vietnam and Nepal. Now, I would love to give our audience the time so we can also ask questions. I will be opening the floor now. So, yeah, so that everyone can ask questions as well. Do we have questions from the audience that you would want to ask either to Lan or Anil? Sibren, you mentioned them. Sibren, do you have a question? No. Does anyone have a question? You can also ask questions. No question? Yeah, Piset. Piset is our colleague from Eye Care Foundation Cambodia. Yeah, Piset.
Yeah, yes, would like to have a question to our both speakers, Anil and Lance. And just both countries have shared a lot of experience and a lot of information about the women's in the country and at the decision-making level and political or politician level, at the government level. Is there any empowering women to be involved in the leadership, like for example, in the quota of the provincial government and at the cabinet, or for example, is there any encouragement for women to be involved in this leadership? Thank you.
Thank you, Piset. Maybe Lan, shall I go first or you want to be
Yes,
first?
please, Anya.
Okay, thank you, Piset. Yes, by constitutions, by rules, by regulations, we do have all kind of things to protect and then have them in the equal things. Okay, so by the constitutions, we say that 33% should be there in a woman. But when we talk about all those in a real implementing, we lag behind. And there is, that's why I said it has to be in the top. Okay, so if the top people, they really change, they really think in that way, to have those kind of things, then it will be easy. But if they do not realize by their inner heart, by only having that in a bylaws and other things, there will be we can have a lot of excuses. So that means we also need to, as you have said it, that there is, by the constitution, by the bylaws and others, there is a system, but we are not yet reached to have that to make it 33% or something like that. Okay, but we need to start that. But it is what I see is from the top level, if we can change them, that will be easy. Thank you.
Yeah, and you said for Vietnam, actually, the number of women in the parliament or in the high-ranking position is very low compared to the number of men. now we have only 25% of them in the parliament seats, and all of them are men. And you know, women are like the head of the women's union, or our Minister of Health, she's a woman. But all the important positions like the Prime Minister or the General Secretary or Ministry of Public Security or Ministry of Defense, they are all men. So I think I cannot say that we need to change that, but I do hope that in the coming, because you know, 15th of March is our election. So we have elections just in a week. So I hope that more people, like population like myself, I will look at the female applicants who are like female and who have some capability, so I can vote for them. So I think that change would be have to increase the number of women in the decision-making position, so that women, we understand women. So with the increasing number of women in the top level, so that I do hope women in the communities, they can get benefit. But I think, as I told you already, that it cannot be changed overnight. It won't take a year. But I can look at 10 years back. So we have some positive changes. So I hope that in the next 10 years or in the next 15 years, we will have achieved more positive impact from now on.
More changes, yeah.
Thank you very much. I really appreciate this, your sharing this. And regarding to the Anil just said that education, and also advocate and empowering the women involved in decision making, and also access eye care, something like that. So this is very good education, but we also would like to apply also, make the thing is real at the women's involved in the decision making and involving in the service delivery, and also the accessibility, the service too. So to me, I think in Cambodia, we have increased a lot of the number for the women who provide the service delivery. If we're looking at the ophthalmologist trained through our ophthalmology program, before is maybe 20-year age or 15-year age, most are men. But if we're looking at the recently years, almost 50-50 male and female. This is the good thing that the government is and the recruitment and enrollment of the UHS or university is the priority in the women. And I used to be a member of the selecting candidate as well. And for those women, we gave another extra score to be enrollment in the university. This is a good encouragement for women involved in the service delivery. So if we're looking at the statistic for ophthalmologists graduate up to date is the 40%, let's say 41%, compared to men is about 58% for the ophthalmologists. But for the refractionists in Cambodia, 44% and 56%. So the number compared to 15 years back is the women is start to increase every year. So this is a good for want to share with you too. Thank you, Dara, and thank you, Lan and Anil, for giving the floor.
Thank you, Seth, for your question. Do we have other questions from the audience? Please feel free to ask them. Or do you have a question, maybe Lan for Anil or Anil to Lan?
Yeah, that is good. Maybe you go ahead, Lan.
I also have a question to Anil, because I'm very interested in the education program in terms of eye health for professional in Nepal. So how long does it take the Nepali government to really set up that educated or that structure?
Actually, Lan, so I already mentioned you about our vertical eye care system. It is not embedded with a government eye care system like in Vietnam you have it. So it's a vertical. So government involvement in this kind of things was very lately introduced. Though in the early years, government only give the permission to do to the NGO like us, non-governmental organizations. So that was one of the beauty that we could do such a great work in 30 years. Okay, but that not being in the government. But the other side is when you are not in the government system, then financial sustainability will come. From the last 30 years, we have been supporting, we have been carrying it, though it's going up, but it will have a difficulty to gain that financial sustainability. So most of our training institutes, the ophthalmic nurses, optometrists, and these ophthalmologists, these training institutes are from outside the government, but we tie up with academic institutes like universities, and then they provide the degree. So there is not much government involvement in this, but nowadays government also start providing the scholarship for those aspiring students to study. But those institutes mostly are located outside the government scope. Okay, but for the recognitions, for the academic accreditations, we have to depend upon one university which is under the government. So that kind of system is there. So that's why it is easy. But I already put you the backside of hindsight of that is it brings us very delay us in the financial sustainability.
Thank you.
Thank you, Lan and Anil. And Anil, do you have further questions for Lan?
Yeah, only the questions for me to learn is when we talk about the eye care system, so we need to talk about the quality. So is there anything that the women and others I relate to that? How is the quality?
It's hard to mention about the quality. I have to say that for the program implemented by INGO, like Eye Care Foundation or the Fred Hollow Foundation, we can ensure the quality because it is already developed and we need to follow the protocol strictly. There's no way that we have to make it wrong in terms of surgery, for instance. However, for some of the activities that I cannot be sure 100% that they can achieve the quality, especially those run by the government outreach, because I don't know how the situation in Nepal, but in Vietnam, there's some private hospital, they go to the community and they do outreach surgery without much quality, and the problem is really crazy. So now Eye Care Foundation will also trying to work with the national government and provincial government to ensure that all the outreach activities, not only by Eye Care NGO, but also from the private hospital, need to ensure the quality strictly, need to follow the protocol strictly, because if they do it free, but the quality is bad, so it rather not to receive the surgery. So if the women, and for that charity outreach done by private hospitals, a lot of them are women. Because through our discussion, you already knew that women, they have limited eye health. So they tend to rely on those charity outreach to receive surgery. So we really need to make it strong to the local government of being selective, of choosing the private hospital who want to do charity. Otherwise, all our efforts in terms of no women left behind won't be in vain. So I really thanks Anil for that question about quality. It is one of the important things that we are working here in Vietnam with the local government to ensure that the quality need to be achieved.
Yeah.
So more women can have access and really can get, how to say, the quality eye surgery so that it can be useful again.
That they deserve. Yeah.
Yeah.
Thank you.
Thank you, Lan. Just to add on, this is why I bring this with the quality and then the woman, all these things with my experience. I'm not saying about men, I'll not focus on the qualities, they neglect it, it's equal. But sometimes when the women are involved, that with my experience, they are meticulous. They are so dream and the protocol, okay, this, do's, that. And then we can ensure those kind of things in a proper way. But when in a team, it will not be the woman, it will not be only the man, but it will be in the joint. But when I have that experience that when the woman really does it, and then they like to do it in a meticulous, perfect way, and then with a good outcome. Those are because they really want to follow all the protocols. It's not saying that others do not follow, but they are a bit meticulous. And then those kind of quality, when we empower those kind of things to the woman, it comes fast as well. Okay, thanks.
Yeah.
Thank you. Thank you, Anil and Lan. Do we have more questions?
No.
Room for one more question from Sambat.
Okay, thank you. Maybe I'm the last. Thank you. So as you have mentioned about desegregation data from male and female, as well as about the quality from part of Anil have mentioned. So my question is regarding to the key influencing factor to cause the woman cannot access properly to the eye care services. So in your country, do you have any measurement to track all the progress of this influencing factor? Yeah, just a question.
Nowadays, if we report it, we have to report it by the gender. Any numbers could be a gender. Okay, how many male, how many female, and other genders in terms of the human resources, all this. And we have something quota, the ceiling. That means certain part we need to fill up with a woman or the lady or the female, all those. But already discuss it. In terms of everything, there is a good system, good rules and other things, but how to implement that? Who will overlook that? Who will monitor that? Those kind of things in the implementation part, we are lagging.
Yeah.
It's hard to measure, Samba. It's really hard. And I know why you asked the question, because it's so challenging. But we are trying. And honestly, I have to say that the data, the gender distributed data from INGO are more validated than the data from the government. Because, you know, they do not have a particular staff to collect all the data. And one person, they are multitask. They have to do a lot of things, so they tend to reuse the data. So that's why it's really hard to measure correctly. So that's why I really mentioned that if I can change one thing tomorrow, I really encourage all the eye care programs run either by local or government or the private need to follow and need to do the gender distributed data so that we can have all the information available. But it's a dream. So I do hope that in few years, so all the data integrated and then we have all information available. But it's really hard to measure somewhat, especially for Vietnam. We have 1 million population, and also we just have changed the administrative changes units in Vietnam. So now is the time that they have to redo everything. So I really don't know when we can apply that.
Thank you, Lan. Thank you, Anil. Further questions, Sambat?
Just something like a little suggestion for our ECF position for ourselves. We might need to define further action, like to define what what kind of the key influencing factor to measure it. Because male and female, it doesn't tell us what the real things happen on our action taken. Example, if you say this woman with the proportion of higher than men, but what it means? When we focus our action at community, which is crowded of women there, why? And what the effect to that woman? It's not just bring the service to the woman, and then you say now women have like the proportion is higher, but actually the knowledge in IELTS of the woman still far from their need. This because of what? Because you are bring the service to them.
Yeah.
But in terms of knowledge of women, we need to find another way. This is just one example. We might need to define, to help each other to define a clear key influencing factor also. Thank you.
Yeah.
Thank you. Thank you, Samba. Thank you, Anil. I think that's the last question. Thank you, everyone. Thank you, first of all, for attending our webinar, No Woman Left Behind. And we have heard from both Sambat, from Lan Luong, our country director in Vietnam, and from Anil Gorkhaly, our country director in Nepal, how much barriers there are for women to access eye care actually. But we have also heard how one surgery, how one ophthalmologist, how one hospital building could help us give access more to women, to provide more services to women. And it is just about providing services. It's also about placing women as leaders, as representation, as policymakers, as decision makers. So we have seen how important not just the provision of services, but also the policy level of having women as our decision makers, as our speaker, like Lan, for today. Thank you, everyone. And we've also, we'd like to thank all our donors who've always been with us in this effort, in this initiative. You've always been with us, helping with the one cataract surgery to a woman, helping one ophthalmologist sent to school to eventually help other women in their communities, and helping a female community health volunteers. So we all know in Eye Care Foundation that, you know, we can make sure that no woman is left behind if we all do this together. So thank you, everyone, for all your help, for your presence, for being with us this morning. Thank you, Luel. Thank you, Luel, and have a nice day. And I would love to leave you with the theme of the 2026 Women's Month. We were doing this because of the celebration of the Women's Month. The theme of the Women's Month is Leading the Change, Women Shaping a Sustainable Future. So with that, I would love to give you that there should be no woman left behind. Thank you, everyone, and have a nice day.
Thank you.
Thank
Bye
you.
bye.
Thank you, Vel.
Good luck.
Have a nice
Thank
day.
you.
Bye-bye.
Bye-bye.
Yeah.
Thank you well.
Thank you well.
Thank you, Vel. Thank you. Bye-bye.
Bye bye.